There are three muscles on the posterior of the thigh that we refer to as the hamstring muscles: the biceps femoris, the semitendinosus, and the semimembranosus. All three of them have origins at the ischium, on the pelvic bone, and cross the knee joint and have their insertions on the tibia, or in the case of the biceps femoris, on the tibia and on the fibula. All three of these muscles are going to play a major role in extension at the hip and flexion at the knee. If we take a little bit of a side view, that makes sense. We can see that these muscles all cross posteriorly of the hip joint and also posteriorly of the knee joint. So if you think of these contracting, it would pull the hip joint, pull the femur this way, which is extension of the hip, and then it would also pull the lower leg this way, which would be flexion at the knee. And at this angle, you can also see the two heads of the biceps femoris. So this is one head of the biceps femoris, and this is the other head. Biceps, bi meaning two. You have a biceps in your arm as well, but this is the biceps femoris because it's the biceps near the femur. And both of these have a common tendon at the distal end that has its insertion on the lateral condyle of the tibia and the head of the fibula. The semitendinosus and semimembranosus have their origin and insertion points at pretty much the same places and act almost completely synergistically. Their main actions are extension of the hip and flexion of the knee, but if we notice, they're also pretty well on the medial side of the hip joint. So at the hip joint, they are also going to assist in adduction and also inward rotation at the hip. And they also can assist in inward rotation at the knee when the knee is in a flex position. And that should make sense based on the location of the muscles, that they would assist in adduction, drawing the femur toward the center of the body, and then inward rotation at both the hip joint and the knee joint. The biceps femoris is on the opposite side of the leg and has the opposite effects of abduction and outward rotation at the hip, and can also assist in outward rotation of the knee when the knee is in a flex position. And you can remember that the biceps femoris is on the outside of the femur, on the outside of the leg, and it assists in outward rotation at the hip and the knee joint, while the semimembranosus and semitendinosus are on the inside, and they're going to assist in inward rotation at the hip and at the knee, and adduction.